Accidental bowel leakage or fecal incontinence is a very common problem and is extremely distressing to anybody, whether it's a male or female, and it's very common in women. And it usually starts off with gas leakage and then eventually could lead to stool leakage. Way back in 1974, Dr. Parks, who gave the presidential address, said, "The plight of a patient with fecal incontinence is a very unhappy one indeed. There is obvious association with uncleanliness and a feeling of being a social outcast. Such a person will not meet people, not leave the house, or be able to do any shopping. If the problem is known to the family, the patient may well be rejected as a result, especially in old age. It is indeed a very grave social problem, especially in the elderly, and anything that would improve it is highly desirable." This is what he wrote in 1974, almost over 50 years back, and we still have the same problem ongoing. So half a century back, and we still have this ongoing problem of bowel leakage that still goes unmanaged. Still, women are wearing pads. Still, women are suffering in silence. Still, women are considered social outcasts by themselves or by others. And they have that constant feeling that everybody around them can actually smell the stool leakage. You know, in my practice in urogynecology, I see this problem of fecal incontinence so frequently. And it is across the ages. You have a young woman who's just had a child, is having difficulty holding her bowels, or could be someone in her 70s and 80s who starts off with gas leakage and now has stool leakage. She doesn't even know, and the stool has come out. So it's a huge problem. But the good news is that we can do a whole lot to help with your bowel leakage condition. And in urogynecology and at AUGM, that is what we specialize in.